Good morning, America, and welcome to this morning's Going on Offense webinar. My name is Daryl Moon, and I'll be your host today. This is our first webinar of this new year, and the first webinar in the new series we'll be doing on aspirational healthcare. The sponsor of this series of webinars is a uniquely proactive mental health and personalized well-being strategy called Resilience Pro. Now, as the COVID pandemic has certainly upended the lives of most Americans and most businesses in this country have drastically been impacted, these webinars that we've been doing since April of 2020 have been focused on going on offense to address the impact the pandemic is having on the emotional well-being and mental health of individuals. This idea of going on offense and being proactive to deal with emotional well-being and problems is really the idea of preventing versus simply fixing a problem after it occurs, and is the foundation of aspirational healthcare, which we would like to introduce in today's webinar. So aspirational healthcare is, instead of solving a problem, focusing on preventing it in the first place, or instead of treating a disease, how do you avoid the disease in the first place? Prescribing a treatment, well, how do you inspire change so a treatment or a prescription isn't needed, or a treatment plan isn't needed? And then instead of healing someone, how do you keep them from getting hurt in the first place and simply celebrating their success at managing their health? Well, even though this idea of prevention has been a focus of mine and a passion of mine for the last 25 years, after I started being a hospital administrator for 10 different hospitals, I've really focused most of my career on prevention. Now, I didn't come up with the term aspirational healthcare. I learned about this term just a couple of months ago through a podcast that a good friend of mine shared with me and encouraged that I listen to. That friend of mine is Martin Davis, and I'm honored to have Martin as my guest today. Martin, will you take a couple of minutes and introduce yourself, and then share with our attendees why you sent the podcast to me and what was the podcast about?
Thanks, Daryl. My name is Martin Davis. I'm in Charlotte, North Carolina. Been involved in healthcare for about the last 6 years through Daryl's generosity more than anything else. And a number of reasons that I have shifted my focus onto healthcare. I've been in marketing for many, many years, and I've been very fortunate personally. I've always had fantastically good health. I really never had any kind of unusual healthcare situations until about 10 years ago. I've been a lifelong exerciser and had basically worn the cartilage out of both of my knees and had meniscus repair. And went to my primary care doctor, with my pain. He referred me to a specialist, and I went down that road. And to make a long story short, I had a horrible experience. I developed an ancillary healthcare condition through the surgery that I'm going to be dealing with the rest of my life. It was a nightmare. And while I was going through that, it just dawned on me how inefficient and siloed our healthcare system is. And that prompted me to just start doing some research. How do we get in this situation? Why is healthcare so expensive? And why are patient outcomes so ineffective? And about a year ago, just out of the blue, had an opportunity to listen to a podcast about an organization in Alaska called South Central Foundation. And South Central Foundation is basically health and human services for Native Americans in Alaska. There's about 160,000 members, Native American members of NUCA, or NUCA is actually the healthcare branch of South Central Foundation. And these people historically had received their healthcare from the federal government through the Indian Healthcare Services. And they got a CEO who looked at the situation and was just appalled at how ineffective the healthcare was that these people were receiving, and totally transformed about 25 years ago, began a total transformation of that healthcare delivery system. Make a long story short again, in the interim, this organization is the only United States healthcare organization that's ever won a Malcolm Baldrige Award. And they've not only won that once, they've won it twice. The Malcolm Baldrige Award is the only award granted by the federal government to reward uh, business excellence. And NUCA is the only organization that's ever won it twice, under the Obama administration and again under the Trump administration. And I listened to about an hour and a half podcast that the medical director, Dr. Doug Eby, had did, and he was basically at a conference in Sweden and was just talking about the NUCA system that they developed. And I sent that on to Daryl, and so anyway, Daryl, that's where we are today, and I'll give it back to you.
Well, and as I began listening to this idea of aspirational healthcare, where an entire system from community health to tertiary care focuses the entire system on this prevention idea and this idea of aspirational healthcare, I was like a kid in a candy shop. It was incredible to hear what Dr. Eby was describing and how he was describing and how the focus is, traditional healthcare is really about an institution of medicine that has all the knowledge and wisdom, and people come to that institution to be benefactors when they fall off a cliff. What the NUCA system of care simply did was turn that upside down and said, why don't we put the customer owner, people are the owner of their own health. Let's put them as the focus, and let's let the healthcare system help them stay as healthy as possible and never fall off the cliff, if that's possible, and just keep them from falling off the cliff in the first place. And so they built from the ground up a system to do that. And what's amazing to me, what is so incredible is that they simply, and it wasn't an easy transition. I'm not trying to put light on the fact that it was a very difficult transition, but they did basic continuous quality improvement strategy to healthcare. And that's why I love running hospitals. Is here I was teaching hospitals about Edwards Deming's philosophies of continuous quality improvement, but you step back in healthcare and go, we don't even apply these principles as an entire industry. And they have the opportunity to say, let's go to the customer and let's find out what the customer wants. And now let's build a system to delight the customer, and then let's monitor to see whether or not we're really, delighting the customer. And as we find variance in those monitors, let's put people closer to the process to improve those processes. But always the focus on meeting the customer's needs, which most industries have to do, and somehow healthcare gets away with not having to do that. I mean, yeah, they'll focus on doctors. As a hospital administrator, I was focused on how to get the doctors to admit to my hospital. Or when you fall off the cliff, let's give you a wonderful experience about getting better. But we seldom focus on putting fences at the top of the cliff. Now, I love the story of the South Central's Foundation's CEO and how she started, and the fact that she wasn't a healthcare expert. In fact, Martin, do you know that story as to how she even started at NUCA or at South Central? Catherine Gottlieb is her name.
I think she was an administrative assistant. Is that correct?
Exactly. Way back when she was young, she started working for South Central as an administrative assistant, worked her way up to be the CEO, and then led a transformation where the entire system said, you know what? This broken ER-based, fix people when they're really sick system is not working. We got these huge lines in the ER, people aren't getting better. And she simply said, let's go to the customer and let's spend 4 or 5 months focusing on figuring out what the customer wants in the way of a healthcare system, and then let's take it over. Let's say to the federal government, we want to do our own system. And then they built a system around what those principles were. And Martin, are you familiar with what those principles that they kind of, some of those principles that they established way back at the very beginning, 20, 25 years ago?
Well, they put in place everything that they could possibly think of to make it easier for people to have access to care. They've used technology light years ahead of anything that's being done in the lower 48, as far as I can tell. About 85% of the people that are members are considered urban members. The other 15% are rural. And in Alaska, rural is really rural. I mean, it's hundreds of miles. Yeah, I mean, and they've integrated technology into their care delivery system in a much, much more sophisticated way than is currently being done. I think, Daryl, I mentioned to you yesterday, I love my primary care physician here. He's a great guy, but I can't send him an email. I mean, that's just the way the system is in the lower 48, and that's totally antithetical to what NUCA's been up to. But anyway, expound on what I am.
As we spoke with one of the representatives yesterday on a phone call, she expressed the fact that she had just hurt her neck, and she called her team member that she's known for years on the cell phone and said, "Hey, this is what's happened." That person put the provider on the phone. They said, "Hey, come in," and was headed in to have a checkup on her neck literally after our phone call. I mean, it was a great example of how she knew who to call. She had that person's cell phone. She picked up the phone, got that person to answer the phone, and they had a long-term relationship. I mean, it wasn't somebody that was brand new. It wasn't a telemedicine call to a brand new provider. It was someone that knew her and she knew, and that was critical.
Well, for instance, down in the lower 48, a typical primary care practice is responsible for about $10 to $12 million worth of healthcare spend annually total, with what the practice deals with and what is referred out. And so a typical primary care doctor in this area might generate about $2 million in the actual practice spend and refer out, another $8 to $10 million annually. And what NUCA has done is NUCA has vastly expanded the care that is delivered on a primary care level. And granted, the typical NUCA clinic is generating, $4 or $5 million to spend probably a year, but down the road, down line, they're saving the system, $5 to $6 or $7 million. And they limit the number of patients in a physician panel as opposed to 3,000 to 5,000 in a primary care practice down here. It's around 1,200 in their system. Patients can get same day appointments, but a typical primary care doc in the NUCA system only sees 7 to 10 patients physically in the clinic a day. The rest of them are dealt with virtually. It's just such a much, in the patient outcomes they get are astounding, because as you can imagine, dealing with a Native American population, all the pathologies that we experience down here are much more prevalent in populations.
Well, when they started, I think they were in the 5% of the HEDIS scores, the very, very bottom.
Daryl, your audio is not functioning.
Oh, is that coming through very well?
There you go. You lost your audio again.
Is it working?
No.
Okay, go ahead. You finish what you were going
to say. Well, getting back to the way that they handle care, they're able to prescribe and deliver medications anywhere in the state of Alaska. They take care of everybody in a rural situation, as I just mentioned, and they actually have drop boxes in villages hundreds of miles away from the pharmacy that they can deliver medications to, and they have a security system in place that prevents abuse of the system by those people in those far off locations. And there's just a number of ways that they have tried to create a very efficient system that actually takes care of the individual. I've never had a physician ask me for my input about the care I was receiving, other than what was happening when I was in an appointment. And I've had some doozies. I mean, I mentioned the one I've had about 10 years ago. I also had to go to the emergency room a couple of years ago. I mean, get the ambulance to come and pick me up. And what we're doing here is so inhumane and it's so expensive. We're spending $4 trillion a year in the United States on healthcare. According to PricewaterhouseCoopers, half of that $4 trillion, $2 trillion, provides no value to the patient, no patient value whatsoever. And probably a lot of people that are on this call today can attest to the amount of money that we're wasting, because they've experienced it personally. And the solution is aspirational healthcare, what Daryl is trying to introduce here. It really is. I'm convinced of that. But anyway.
Can you hear me now?
Sure.
Am I coming through better now?
Absolutely.
Awesome. So yeah, what I wanted to mention is one, if you've got any questions, those that are attending, please feel free to send those through your control box and we'll try to respond to those. But I wanted to mention just what those principles that they gathered from the customer way early on when they first started this. They went out and spent 5 months just saying, what does the customer want? And I'll share with you what they came up with. These are the pillars that they built the program on. Customer owner, they give me what I and my team have defined I need, when, where, and how I want, or how I want and need it in a safe, effective, and optimized way. They really know me and care about me. They listen to me, advise me, and support me on my entire health journey. And then finally, my questions and concerns are answered, my care is coordinated, my values and goals are what drive my health plans. You know, I love to, let me share with you just some of the outcomes that they've shared with me as to the impact that they've had on the health of their group. So this is kind of the why, you know, you should listen to what the NUCA system has built or developed. Their per capita visits to ER went down by over 60%. Their hospital admissions and days went down by over 60%. Their visits to specialists went down by over 60%. Health outcomes dramatically improved. Diabetes, asthma, HIV outcomes now are in the top 20% of the nation. When they started, they were in the bottom 5%. And quite honestly, they're taking care of a very difficult, challenging population when it comes to health. Their staff turnover is 1/5 of what it used to be. Their cost per person per year is a half of what it used to be, and about half the US national average. Evidence-based generational change reducing family violence has been significant. Childhood immunization rates are at 93%. Diabetes with 50% of HbA1c below 7%, and customer and staff overall satisfaction over 90%. And they've done all of that in a very urban Alaska Native community with huge challenges. So pretty incredible what they pulled off by simply focusing on a customer-based system versus a provider-based system.
It really is amazing when you compare it to what's going on in the lower 48. I mean, we've got, like I said, $4 trillion of annual spend. That equates to about $10,000 per human being. And NUCA's providing a much higher quality of care for about $4,500 in Alaska. And Alaska is an extremely expensive state to do business in because they've got to import everything from all over the place.
Right.
It's just very expensive and very difficult to implement, and they've been able to do it because they actually have tried to, as opposed to a physician-centric healthcare delivery system, they have a customer-owner system. And they go about it just like any other business would that's successful in the lower 48 states. When you deal with Amazon, you get an excellent, I've never had anything but an excellent customer experience when I've dealt with Amazon. It can be done. It's very difficult. There's no doubt about it. It took them about 2 years. They had some pushback from a lot of staff when they decided to implement this system. The challenges in healthcare are always enormous, but they've created such a more humane system. It's better for the patient, the customer, the owner. It's better for everybody that is practicing care in the NUCA system is working at the top of their license, whatever that may be.
Right.
And they know the thing you touched on is really important. They actually know who you are. They really do, and they give more attention to the people that really need it. It's a much more efficient, effective way of going about delivering healthcare.
And I love their motto to where it's more important to engage the person in change than it is to get a perfect diagnosis and a perfect treatment plan. And I'll share the analogy that Dr. Eby has shared so many times, which is, I love this analogy. And that is that often medicine is a science, and it's about applying a science to a problem. It's like throwing a rock at a target. And the more times you throw the rock at the target, the more effective you'll get at hitting the target. Well, when you sit back and look at healthcare, only about 20% of healthcare is throwing rocks at targets. Like if I go into the emergency comatose and I'm literally bleeding out, I'm at the full control. That system has control over whether I'm going to survive or not. And so they apply their best science to get me back to some level of health. Well, that only represents 20% of healthcare and healthcare spend. The other 80%, as Dr. Eby likes to describe, is like having a live bird in your hand and trying to encourage that bird, throw that bird towards the target. Well, that bird isn't going to hit the target every time because that bird it's the owner. It's going to decide where it wants to go. And if you want that bird to fly towards the target, you might have to put the birdhouse at the target and the baby birds at the target and do some things to encourage that bird to go to the target. So because they understand how we as individuals are really the owners of our own health, they build a system around building long-term relationships with people so that they can influence for good where those people are managing their health. I love their use of storytelling. Storytelling is a huge cultural thing for the Native Alaskans. Well, that concept of tell me your story and let me get to really understand you isn't just something that works in Alaska. Building relationships is something that works with people, and helping people change behavior and be owners of their own health requires a lasting relationship and a more trusting relationship.
Well, we're so fortunate in this country. The problems that we have in the main with health is over 80% of what we spend on healthcare is to treat conditions resulting from poor lifestyles. In 1940, right, the draft was implemented in 1940 to deal with the world situation. 25% of draftees in 1940 were denied entrance into the military because they were malnourished in the United States. That's a staggering number.
It is.
Today, the biggest problem we have in this country by far is obesity. As far as healthcare, 40% of Americans are obese. Like 90 million Americans are overweight at least. And this triggers cardiovascular disease. It just fans out from there. And it's the hardest thing in the world to do is to get somebody to change their behavior. And that is the real secret to the NUCA system, because they, as Daryl said, they develop relationships with patients, and everybody on staff is trained in best practices of behavioral change. And they all practice this, and they're able to help their members, their owners, their patients change their behavior. And this is the key. This is what's got to happen in our country, because we can't continue down the path we're going. We really can't.
Well, and I want to reemphasize what you said earlier, and that is that they take their entire population and they divide it up into small groups of 1,000 or 1,200 people, and they assign a team, a provider team, to get to know those 1,000 or 1,200 people well. So it's made up of a physician, a case manager, might be a nurse case manager, and a medical assistant. That team of 3 people, their job is to proactively get to know and build a trusting relationship with their 1,200 people, whether they're sick or not. It's not about once you fall off the cliff, let's come fix you. It's about building those relationships before they fall off the cliff to prevent that from happening. And then that small team of 3 people are backed up by behavioralists and nutritionists and pharmacists and physical therapists, so that there's this team who is there to meet the person's need. And I loved what Tanya said about the fact that she knows her team, and she knows how to pick up the phone and call a member of their team on their cell phone and get an answer right then. And she knows that through her team, she has access to everyone she would ever need. If she needs a specialist, she's going to get that through her team, because her team's going to bring that specialist, whether it's a cardiologist or a podiatrist or whatever it is. That team is going to bring that specialist into that relationship to help that patient, which is just the opposite of what we generally think of when we think of a deficit-based healthcare system, which is primary care is really about 4,000 or 5,000 patients in each practice. Come in when you have a problem. I'll send you out after 12 minutes with either a diagnosis and a prescription, or a diagnosis or a specialist referral. You go off to the specialist, and that specialist may or may not ever communicate back with that doctor because they're not getting reimbursed to. And so you, the patient, wind up being the advocate and the coordinator of all of that.
Well, I told at the beginning of the half hour, I was talking about my experience with my meniscus repair. My primary care physician referred me to a specialist. I never had another conversation with my primary care doctor about the experience, about anything about it. It just, that was it.
Yep.
And when, for instance, you're never stranded. You don't fall through the cracks with NUCA. If you do need hospitalization, you've got a care manager, in the practice that's going to get you admitted and get you sent out. I mean, there's always somebody dealing with you all the time, and they're going to know what the outcome was, and you're not going to fall through the cracks. It's just a much more humane, sensible, wonderful way to deliver healthcare. Everything they do is trying to get better. They're always trying to get better and improve. Everything in the system that we've got in the United States thrives on illness. It thrives on big problems. 75% of what we spend is to treat chronic conditions, and we have worse outcomes than just about any major industrialized country in the world. Because the more problems you have, the more you can build, the more money everybody makes. We've got $4 trillion of intransigence, $4 trillion, and nobody is going to take a pay cut. It's just not going to happen. And the BUCAs are certainly the more money that the system turns out, the more money that they make, and it's a vicious cycle. But it can be broken, and we've got some ideas about that. So.
Well, and it is that perverse incentive. I've often said that the healthcare system that we're familiar with, the deficit-based healthcare system, is like driving a car on 4 blown out tires. And we want to tune the engine and we want to align the tires, but it's like, why don't we fill up the blown out tires? That car's not going to go. One, it's going in the wrong direction, and 2, it's not going to go very well if the tires are blown out. Right. And so I've often said that those 4 tires are. And what's amazing is, as I learned about NUCA, I'm like, they have dealt with all 4 things so extremely well, which is why their system works so well. It's primary care. That's the first tire. And they built, like you said, a massively powerful primary care system that gets to know each person and focused on helping that person enjoy the best possible quality of health they can. The next one is advocacy and navigation. They become the logistics team. They don't send you off with 3 names to a specialist. They actually bring the specialist in and they coordinate your care all the way from community health to tertiary care. We don't do that very well in this country. The next thing is behavioral change. Like you said, they've recognized by going to the customer and asking what the customer wants that the primary focus of the system is engaging people in change. And so they've applied best practices of behavioral change. We don't do that in this country. We don't even focus. It's like, you doing what I tell you to, that's your job. I'll just give you the best treatment plan and you go figure it out. And then the final thing is mental health. We know in this country we do a terrible job at managing the worst risk factor there is. More cost comes out of poor mental health than any other risk factor. Yep. And yet what they've done is they've built in a behavioralist in that team. And so they don't have to send someone off to someone. The team is made up of a behavioralist, and each member on the team is trained in empathetic listening and motivational interviewing, helping to get that person to share and get over the stigma that so often is the problem with mental health, is that people wait 10 years on average before they'll address mental health symptoms. And 57% of the people never do. Well, NUCA's built a system based on relationships and trust and helping people to open up about those things early. And clearly it's not a perfect system and everybody up there is perfectly healthy. I'm not saying that, but they build a system that responds to the needs of the individual and can engage people early in intervention, which is so amazing.
The mental health aspect is so huge, and of course, the chain of events that we've set in motion since last March, we're going to be suffering. People are going to be dealing with the trauma from COVID-19 for this is going to be a permanent thing. Children are really, really, really impacted negatively by governmental action, in my opinion. To take children out of school, I'm in Charlotte, like I said this morning, the county health director ordered all the schools to do everything virtually for at least the next 3 weeks. And that's just devastating for children not to have the opportunity to be around other children. I mean, to isolate people at that age is just terrible. So.
Yeah. So Martin, we're running out of time. We've only got a couple of minutes left. And before I announce some really cool conferences coming up about this aspirational healthcare. Just if there's anything you wanted to maybe share that we didn't get to ask or that you want to maybe plug, what would that be?
Well, the model that NUCA has created should be uh, primary care best practices worldwide. And I would encourage everybody that's on this call to attend their conference. This is a big deal. And also the conference that Daryl's putting together in July. These are two must-sees in my opinion. So I'll leave you with that.
Well, and I'm glad you brought that up, because it's been clear over the years that countries from all over the world have flown to Alaska to figure out, how are you able to do this? You know, how can you put out such great outcomes at such a low cost? And so countries like Sweden and Netherlands and parts of Canada and Singapore have all gone to Alaska and have worked on trying to duplicate some of those principles in their own countries. There's a Cherokee tribe in North Carolina that has literally duplicated the NUCA system in North Carolina and had similar outcomes with their particular tribe, because they simply said, let's just learn from what NUCA's done. So with that, let me simply say, thank you for participating today. I'll mention again that Resilience Pro is the sponsor of this series of webinars, and a brochure describing the solution is available for you to download through your control box right now. Our next webinar will be in 2 weeks. On Wednesday, January 27th, we'll be further discussing this aspirational healthcare model and diving deeper into how it works. Join me on Wednesday, January 27th at 9 a.m. Mountain Standard Time. And as a reminder, the recordings of all of these webinars are posted on goingonoffense.com. This website contains a host of other ideas, suggestions, resources, and helps for organizations that want to provide emotional well-being support in a proactive, aspirational healthcare way to their employees during these difficult times. We suggest you check them out. Now, I'm also very pleased to announce that we'll be organizing a virtual aspirational healthcare conference this summer, July 14th and 15th, where we will be highlighting the NUCA system of care and other similar systems that have gone beyond the traditional deficit-based healthcare system. Representatives from NUCA system of care will be sharing important insights during the conference that they've learned in developing an aspirational healthcare system. If you're interested in learning more, go to aspirationalhealthcare.com. I would also like to mention, as Martin said, that the South Central Foundation, that's the organization, is putting on their own conference and due every year called the Winter Conference. To learn more about it, just simply search NUCA, N-U-K-A, Winter Conference, or go to SCF NUCA, so South Central Foundation, NUKA.com/experiences/conference/winter-conference/. So with that, check it out. Highly recommend. As Martin said, both of those conferences coming up will be focused on learning from the folks at NUCA how to implement an aspirational healthcare system. By the way, the winter conference that NUCA is putting on will be February 8th and 10th. So with that, we'll sign off. Again, thank you, Martin.
Thank you.
And we'll wish everyone a wonderful day.